Phase variable means that each breath, how it starts, how it reaches the maximum, and how it ends the inspiration. It is called phase variables. Phase variable is that we call as a TLC, total ecosecond. So TLC means that T is a trigger, it's a limit and a cycle. Trigger means that initiation of the inspiration. Here is the initiation of inspiration. Okay, initiation of inspiration. This trigger. Limit means that how my control variable reach the preset value. That is the limit. Cycle means that it is how the inspiration ends to expiration. Okay, three things. The trigger means initiation of the inspiration. Limit I will explain in end of the inspiration. So here first we discuss about the trigger variable. The trigger variable means that how the initiation of the breath occurs. Okay, there is a three variables are there. Some other time trigger, pressure trigger and flow trigger. Okay, the time trigger means a breath is initiated at a preset time. Pressure trigger means whenever the patients generate a inspiratory effort, the ventilator will sense the pressure changes in the circuit and gives a breath. That is a pressure trigger. If it is patient's flow trigger means that whenever the patient generate inspiratory effort, the ventilator detect the flow changes in the circuit, then gives the breath. The ventilator detect a flow changes, it is a flow trigger. Ventilator sense the pressure changes, it means a pressure trigger. There is no spontaneous effort. Ventilator deliver a breath at a preset time, it's called time trigger. First see here how time trigger. This is one of the volume control mode. The rate is 12 per minute. Okay. So if 12 per minute means each breath is 5 seconds, right? So the ventilator you deliver a breath at every 5 seconds. It's called time trigger. It's a ventilator deliver a breath at preset time. Here you see here this is 0, 5 seconds, 10, 15, 20. So, irrespective of that, ventilator will deliver a breath at every 5 seconds. Okay. So, it's called time triggered breath. Next is a assisted breath. Assisted breath means normally the old ventilators are, we see the control mode, assisted mode, assist control mode. So, newer ventilators are there is no control mode, all are assisted breath, which means that whenever the patient wanted to take spontaneous breath, whenever the ventilator senses the patient inspiratory effort, ventilator will give the breath. Okay. So, all our ventilators are automatic device designed to perform some portion of work to achieve adequate gas exchange. Assisted means ventilator does work on a patient, which means that patient initiate the breath, ventilator work for the patient, which means that assisted breath. Here, this is the pressure waveform. I see here that these are the mandatory breath. Example, if example same 12 breaths per minute. So, each breath is 5 cycles, right? So, the ventilator will give every 5 seconds, ventilator will give the breaths. Okay, this is one of the mandatory breath. This is one of the mandatory breath. So, if the patient generating some patients want to start breath. Okay. Before 5 seconds, if example before 5 seconds, the patient generating some negative pressure, which was detected by the ventilator give that mandatory breath at mandatory breath. If example in the volume control, I set a respiratory rate of 12, tidal volume of 400, okay, my PP is 5, okay. So, these breaths are 400 tidal volume, 400 tidal volume. Here, the patient initiate the breath, but ventilator deliver this same amount of tidal volume to here also. This is called assisted breath. Okay. So, if example next breath, ventilator will wait for that. If patient taking any spontaneous breath here, then ventilator will give the one more assisted breath here. Otherwise, ventilator will give the next breath at the free fixed time. Okay. So, it's called assisted breath. So, assisted breath are patient will trigger the breath and ventilator does the work on a patient. It's an assisted breath.